Home sleep apnea testing can diagnose obstructive sleep apnea in people at moderate to high risk of having obstructive sleep apnea. Home sleep apnea testing devices are more convenient and less expensive than in-laboratory polysomnography. Polysomnography is recommended instead of home sleep apnea testing for patients with significant cardiorespiratory disease, potential respiratory muscle weakness due to a neuromuscular condition, awake hypoventilation or suspected sleep-related hypoventilation, long-term opioid medication use, severe insomnia and history of stroke and in children younger than 18 years. Obstructive sleep apnea affects approximately 17% of women and 34% of men in the US, and it is diagnosed with a sleep study done either at home or in a laboratory. The diagnosis of OSA is based on the Apnea-Hypopnea Index (AHI), consisting of the number of apnea and hypopnea events per hour of sleep. OSA is defined by an AHI level greater than 5 and is classified as mild, 5 to 14.9 events per hour, moderate, 15 to 29.9 events per hour, or severe, 30 or more events per hour. Compared with polysomnography, home sleep apnea testing devices monitor various physiological signals but do not provide a direct assessment of sleep because they do not incorporate electroencephalography, electrooculography and surface electromyography. Commonly used home sleep apnea testing devices. Type 3. Measure at least 4 physiological parameters, typically 2 respiratory variables, airflow and thoracic movement, a cardiac variable electrocardiographic or heart rate and pulse oximetry. Respiratory events are recorded if airflow amplitude and oxygen saturation both decrease during a segment of sleep. Other home sleep apnea testing devices. Type 4. Use peripheral arterial tonometry, a watch-sized computer worn on the wrist that measures the pulsatile arterial waveform. Respiratory events are recorded during episodes of oxyhemoglobin desaturation, heart rate acceleration and dampening of arterial pulsation amplitude. Home sleep apnea testing devices that use PAT often incorporate a device that measures limb movement and provides an indirect assessment of sleep. A meta-analysis of 19 studies comparing type 3 home sleep apnea testing devices with polysomnography in adults with suspected sleep-disordered breathing reported that home sleep apnea testing had a sensitivity of 93% and a specificity of 60% if the AHI was 5 or more events per hour, and it reported a sensitivity of 79% and a specificity of 90% if the AHI was 30 or more events per hour. Although polysomnography provides a comprehensive assessment of sleep, it is more expensive than a home sleep apnea testing device and requires travel to a sleep center, which is inconvenient for some patients.
Thank you for listening. Subscribe to Diseases Simplified for more health tips and updates.